Occupational therapy is considered a healthcare program or providers in which we treat and work with individuals from newborn to the elderly who have experienced some limitation in their ability to perform the occupations that they engage in every day. I am Dr. Shirley A. Wells, and I am Chair and Associate Professor of the Occupational Therapy Program at the University of Texas, Rio Grande Valley. Applicants to our Occupational Therapy Program, we're looking at a variety of variables. One is their academic performance, their overall academic performance in terms of undergraduates or any kind of coursework they have taken. We also have set prerequisite courses that we look at their academic performance on that. We do require the students to take the graduate record examination, the GRE, the verbal, qualitative, as well as the written component of that exam. We look at their volunteer hours, which is very different than observation. We're wanting to know, are you willing to give back, and how much time and commitment you have just to providing service and working with others. So we look at that. We may look at some of the jobs that you've had in the past. And then there's a personal statement of what is your goal? What do you want to do? How did you get into OT? What did you know about OT? So we look at all of those factors. It's not one is weighted any more than the other. They all are extremely important to us as we are trying to decide who will get into the program and who will not. We tend to admit about 22 to 28 students a year, even though we're hoping to increase that in the future. And we admit one cohort a year. Program is 2.5 years. 2 years of full academic work, and then the last 6 months is when you're out in the clinic doing full-time rotation.
My name is Magda Lizondo. I'm currently a third-year occupational therapy student. Coming from a large university, it was good to come to UT RGV because it gave me that one-on-one experience with professors in smaller classes. It also gave me the chance to become a leader. I'm currently the SOTA president. SOTA stands for the Student Occupational Therapy Association. We do a lot of fundraisers, and then at the end of the year, we donate a certain percentage to a local charity here.
SOTA is a part of the program, and pretty much because even our national body requires us to have a SOTA, because it mirrors the professional organization in terms of structure, in terms of function. Again, we are trying to develop and mold students into what we expect for them once they become professional. And it is part of our way of integrating and molding them into the profession of occupational therapy. And one of the things we do, we get involved, we run for office, we do community involvement. So we try to make sure that SOTA mirrors exactly the expectation we will have for them as profession. But it is all student ran, and we're just there, and we have a lot of things at our national organization, at our national conference. So it's not just, it's maybe a local chapter, but it is part of the larger organization.
Hi, my name is Nicole Garcia, and I'm in the Master's of Occupational Therapy program. All the professors have a lot of years of experience both with teaching and as a working OT. We did a lot of hands-on in the classroom, a lot of real-world scenarios, and they did a lot of focusing on helping us to think like an OT. But they're all really helpful. They really want to see us succeed. They're always there to answer questions, and you have the same professors each semester, so you have them multiple times. So I've got to know them really well. I've got to put them as for letters of recommendation and as references on my resume. So yeah, they're all great.
All of the faculty, current faculty, is at doctorate level or in a doctorate program, one or the other, and have over, I think, as a whole, we've got about 100 years of clinical experience among all of us together from a variety of settings. Because depending on your practice area, as OTs, once we start to practice, you tend to develop a practice expertise in a specific area. So all the faculty come with their own individual area of expertise. And then that is what really enriches the program.
The program's also really research-based, so every semester we had a research course, and that's something they emphasize because we are the future of our profession and research is really important.
Research is a very strong component of our program, and students are required not only to work with the faculty, because that is a required course. We have a research practicum class you have to take, in which you are assigned to work with a faculty on their research project, or you can initiate your own research project. The students are required to take a research course every semester, and within those courses they will be doing what we call mini research projects. And we have had students to take those mini projects and have turned them into full-fledged research studies that have gone through the IRD, they did the data collecting, and then they were accepted for national presentation at our annual conference. For the past 4 years, we've had students' presentations who are actually accepted at the national conference. The little small studies they started here that grew into big studies.
My research is on homeless veterans in the Rio Grande Valley, and I was actually able to present that at the 2017 AOTA conference in Philadelphia this year.
The job prospect for occupational therapists is great, and it is expected to increase at least by 30% from now until 2034. It is a great career, great opportunities, with new graduates starting out around $60,000-65,000 a year right out of school, and that is at the master's level.
There's actually a lack of therapists in the Valley. There's a great need all around the Valley for occupational therapy, so there's a lot of opportunities here. I would recommend it, specifically our program, just because, like I said, the class size is really small, and that's something that I really valued. I think UTRGV with the merge is a really strong university. All of the departments are helpful for anything you need for people coming out of state. I've heard from my classmates that they're really helpful. And just the program in general, they're growing, they're adding more faculty to the program. They're expanding our options where we can do internships, our fieldwork opportunities. So yeah, I think just with the merge and the university growing, there's going to be a lot more opportunities in the future as well.
I would recommend UTRGV for a future student because it's research-based. You do a lot of research. You have opportunities to volunteer at different fundraisers, volunteer opportunities, and you get really close to your classmates. So with that cohort, you move the whole 2 years.
It is a very strenuous program. If you're not into studying, and it is very different because it is also a graduate program, and that's what many students come in thinking it's just like undergraduate. No, we do not stop students from working, but we do not recommend it. We are a full-time day, evening program. I basically tell the students, you belong to me for 2.5 years. We will dictate your every move, but you'll be surprised at how fast that 2.5 year goes. And once you graduate, then you're eligible to sit for the national exam. And once you pass the exam and receive your license and registration, the world is yours.